Dr. Sasidhar Reddy. I am a plastic, reconstructive and cosmetic surgeon at Rainbow Children Hospitals. Cleft lip and palate is a common problem in children. The incidence of the problem is very high in our country. So what is cleft lip and palate? During the early days of development of the child in the womb of the mother, the right and left parts of the lip might fail to fuse. And similarly, the roof of the oral cavity inside is called palate, and even the palatine shelves that fail to fuse. And at the time of the delivery, child may present with gap in the lip and palate. So the reasons of this problem can be genetic or environmental. So the child can have only cleft lip, only cleft palate, or combination of both cleft lip and palate. It can be on one side, it can be on both sides. There can be associated nose problems with this cleft lip palate. Having a child with cleft lip palate in the family is a stressful thing, but we have to understand that it is a completely correctable problem. So when we say problems, what are the problems associated with this cleft lip and palate? So the child can have problems with feeding, there can be speech issues, there can be ear infections, there can be dental issues, and there can be social and emotional problems. Feeding. Generally, a child with a cleft lip gets away with this problem. We can manage. A child with cleft palate finds it very difficult to suck milk and to swallow food. Whatever the child is fed, the food enters into the nasal passages and it comes out through the nose outside. Speech. Speech is a complex mechanism involving multiple organs like vocal cords, pharynx, soft and hard palates, gums, teeth, and lips. And palate has a strong role in the production of the sounds. So whenever there is a gap in the palate, the sound produced inside the mouth can go aberrantly into the nasal cavity, and the sound produced by the child will have a thick nasal tone, and it becomes difficult to understand that speech. There is a communicating tube between the oropharynx and the middle ear, which is called eustachian tube. And due to abnormal anatomy, the fluid gets accumulated in the middle ear, and these children face frequent ear infection problems. There can be dental problems as well, like malalignments and tooth anomalies, abnormalities, and all these things. When the child comes to school going age, he starts developing stigma, and that can lead to social and emotional problems. So, what is the treatment of this problem? The treatment is a multimodality approach, and it is a long term one. Surgery is the cornerstone. Timely done surgery and technically good surgery should give wonderful results. Generally, the lip is operated at the age of 3 to 4 months, and the palate is operated at in between 9 months and 12 months when the child starts developing speech. After the palate surgery, the child is assigned to a speech therapist and regularly assessed for the improvement in speech. For these surgeries, the child should have weight appropriate to his age. So the next surgery required generally will be in between 9 to 11 years to fill in the gap between gums. Bone grafting is done in between the gums, which is called alveolar bone grafting. And at around 16-17 years of age, the final corrections of the nose are done, which is called secondary cleft lip nose deformity correction by rhinoplasty. So every child is special, and some children, in spite of the palate repair and good speech therapy, if they do not develop good speech, some specific tests are done to find the movement of the soft palate, and procedures called pharyngoplasties can be done to give better results in between around 3 to 5 years of age. So even dental corrections and facial bone corrections like orthodontic and orthodontic procedures are required at appropriate ages. On a regular day of a surgery, what is it like for a lip and palate surgery is after the procedure, the child um, is given feed when the child is completely conscious after a few hours of the surgery. And the sutures we use are absorbable sutures and they get dissolved with time. The child is required in the hospital for 1 or 2 days, and the regular downtime should be around 5 to 7 days. So the take-home message is cleft lip palate is a common problem. The family and the medical fraternity treating the problem should understand the problem correctly and the solutions at present available and should get committed to give the best to the child.